So good afternoon, everyone. After what Urvashi and the entire panel on insurance has touched the burning nerves on insurance, it's always the trending topic and people have so many queries. And it's always very realistic. It's a relatable topic, and that's why I see there's so much of discussion still going on. Now we have a panel with a lot of variation. I welcome you all to this panel on shaping the future of Indian healthcare. Myself, Dr. Charu Dutt Arora, I'm a palliative care specialist. And we're going to have a panel discussion on how global opportunities, challenges, and innovations are on the way for India as a global healthcare leader. I know the next 30 minutes, you all will have, or your subconscious still rotating on what do we have for lunch. But excuse me for that, and I would expect more engagement so that we talk more substance. We have some amazing names on the panel with variations from information technology. We have a legend in medicine. We have somebody from SEPC, and we have one from pharmaceuticals. So we'll start with Abhay ji. Abhay is representing SEPC, and he's the Director General at SEPC. Now, Abhay, when it comes to India as, the shaping the global opportunities, challenges, and innovations for Indian healthcare system, what strategies do you see from a government and a policy perspective to expand India's global healthcare footprint? And how do you envision India on the global stage in the next decade?
Yes, in fact, thank you for mentioning this. And thanks for this question being put up to me, and among the distinguished panelists, I have the opportunity to speak first. Thank you so much. Services Export Promotion Council, that's ACPC, is under Ministry of Commerce, set up long time back, but relatively young organization, 2006. It has all the services mandated for export promotion. But when we talk about export promotion, it is not just talking about the export, it is also about the entire value chain proposition, the competence development. So basically, 4 pillars are there on which all our offerings, all our activities are around. Trade intelligence, that's about market. Export development, that's about entire competence training and skilling. Export promotion, more visual part, where we take delegations, invite overseas, business partners, potential business prospects, exhibitions, and all those things. And the last one, but not the least, to act as a platform for policy intervention. Policy intervention not only to, to make the policies, but also how do those policies facilitate the intent, how the services could be provided. So as an enabler, within the country, outside the country as well. So all cross-border trade-related policies, FTAs, that comes under our fold. Coming back to the healthcare, MVT, of course, as we always relate with healthcare, whenever we talk about healthcare services, MVT comes first to our mind. That is medical value tourism. And of course, India has created a niche for itself, more based on the competence level, the experts, we have the doctors. In fact, various studies says that in US, for example, every 6th doctor is an Indian. So we are already having those credibility, trust, and based on the trust, credibility, and affordability, India has a position in the international market as a destination for medical value tourism. But still, long way to go. When we analyze the data, we find that most of the patients which are coming to India are from the nearby countries. And in some kind of areas, we have started attracting patients from farther distance, but a long way to go. There comes one more. In fact, in the previous session, there was a talk about insurance. So that is also one of the area of concern, that in what way that can also act as an enabler for having patients all the way from US and Latin America, South America, all those places. So their Ministry of Commerce is having a lot of interaction with their stakeholders. So we need to understand that where we can have competence when we talk about the competition, these like from Turkey, Thailand, various other places, we are actually having a lot of competition. We need to find out which are the areas where India can focus, and that can create a kind of cascading effect in a positive way for other therapeutic areas to be promoted as where India can act as a global healthcare destination. So efforts like Sanjeevani, efforts like in FTAs also regulatory barriers, and at the same time we are trying to integrate it with the professionals also, not only doctors but also nursing, daycare, paramedics. So all those parameters we are integrating in our effort. So this is the way to go. Like I believe a lot more thought process will emerge, and I can reflect.
Absolutely, absolutely. Very well said, Abhijit. Moving to Manish. Manish represents Google Health, and so Manish, you come with an experience from management and IT, and it's nice to have people collaborating with healthcare nowadays. So my question to you will be, how do you feel that there's a balance for the need for innovation and modernization in the field of healthcare so that India becomes a global healthcare leader in the coming few years?
Thanks for the question, Charu, and a warm good afternoon to everyone. It's indeed a warm afternoon today, and I'm thankful to Harbinder that I was not in the last panel, so that I got a chance to speak on this one, despite health insurance being one of the remits that I carry. So very, very pertinent question, Charu, that in terms of when we look at tech, and I was just reading the motto that you have created for today's session, which is ideas, innovation, and impact. What is very important to understand is ideas and innovation are nothing if the impact is something that we miss out. And I think we are trying to have that trajectory in this. In Google, one of the things that we say is that I was talking to the panel as well, that health moves at the speed of trust. And I think it's a very, very important thing to understand that technology is something that we have to make it accessible. I can see a lot of people right now looking at their phones and maybe busy chatting on maybe LinkedIn, WhatsApp, or anything what they are doing. That's how it has become, how pervasive this has become. So now the important essence that what we are trying to solve is that even for healthcare, can it be so simple? That can be made. I think one of the things that I hate to call anyone in healthcare as a patient, I call them wellness users. The entire intent, what we are trying to do is that can this entire world move towards a preventive care rather than corrective care, right? That is where we move from a sick care to healthcare kind of a mindset. Now, coming to the second part about creating that balance. One of the key things that is part of your question, that how do we create that right balance? I think to me the right balance is going to be when that technology that we are innovating on can be made so easy when a clinician uses it, he or she finds a value. Because often what we miss is we are obsessed with the wellness user experience, but we often miss the caregivers who are actually giving that experience. And one of the things when you are looking at the doctor-patient ratio for a country like us, it is even more important that we help the clinicians to see more patients per day. And someone made a comment in the last panel, and I really could resonate with that the empathy piece, we often want that the clinicians, while they are talking to you, deliver that empathy, listen to your problem empathetically. But if I ask the clinician to just keep inputting information, that cannot be made possible, right? So can we move from that mindset that only EHRs can solve the problem? I think that is one thing that we are trying to look at. Second important aspect that I want to talk about is, I think there's enough of overdose, I'm sure, on artificial intelligence. But I firmly believe and passionately believe that healthcare is one of the most important industries which will benefit from that. The reason being, there's a lot of data in healthcare. I think one study that we did revealed, and this is a global one, that 80% of healthcare data comes in the unstructured side, which means they are images, it is doctor notes, it is discharge summaries, and only the 20% is in the formal system. And what artificial intelligence and especially generative AI is trying to do is, can it look at all that information and help create that larger record? So I just want to summarize this part of the question, Charu, which is, if you need to create the right balance. One, we will have to democratize this technology, make it so easy that the clinicians, the healthcare professionals, the administrators, the technicians, phlebotomists, everybody finds value in using it, so that the economies of scale work. Second thing is, when we are applying that, we look at the end outcome in mind. For example, if I were to make a clinical decision support system helping a doctor, is it really helping him or her build that prescription faster, or maybe carry out the diagnosis faster?
Very well put, very well put. Now moving to, Manish just mentioned on what should be done. Now moving to a legend himself, Dr. Anupam, you have seen, it's been more than 5 decades of your practice, and you've seen, a different genre of medicine. So many years ago when we had polio wards and, diarrhea beds, and now chat GPT based patient centric care. Can you tell our audience any one major innovation that has been implemented in your department or at your institution that has impacted, the patient care in a positive manner?
When you look at innovations which impact the healthcare in a big way, in my own institution, which moved from a sort of a nursing home, 50-bedded nursing home in 70s, Sir Gangaram Hospital, and now to more than 800, 900 beds, and providing great quality care. What has made a major impact is the introduction of post-graduation and introduction of national board examinations. It has tremendously improved the thinking of the consultants. We are kept on our toes by our residents, and more so in the last 5 to 10 years, because Google in a second what I'm saying is correct or not correct, and interrupt me and say, so this is also a part of the whole thing. And that keeps us on our toes. It also has improved patient care in a big way, in a very, very big way, because even our nurses are versant with doing this sort of thing, and it has improved things. Now, that is the innovation which may be years back, which was introduced, but it is impacting this thing. To carry that innovation further, we have been talking about how to improve the, people who are coming for medical tourism in our country. There are 2-3 things what makes us different from the Western world. One is that they have standard operating procedures for everything in their book, okay? So that makes a tremendous impact if you have SOPs for each and everything. And then there are cross-checks. Even the sisters are allowed to check me if I've written a prescription wrongly in the inpatient. The other is that not only the SOPs, it is also what I call as the soft skills. We've been talking about empathy and sympathy. That exactly is what a soft skill is. And that is totally, totally absent in our institutions. You go to any casualty, any emergency, I think they are quite hard pressed all the time. And that makes them abrupt. They do not have the time or the inclination to even talk. Even if they have the time, it becomes a habit not to talk and not to give the information properly. So I think what we have to learn for the Western world is soft skills and standard operating procedures. To carry the thing further and combining the two things, what we have learned is that, for example, we have had a tie-up with the Hospital for Sick Kids in Toronto, which is one of the topmost institutions in the world as far as children care is concerned. And what they have done is that they are training people from African continent. They give them the scholarship. They come to us for training.
Like an exchange program.
Yeah, like an exchange program, but they are not sending their people, they're sending people from Africa to come to us. And that is what we have to do. We have to train people from Africa, Asia, and other countries, what we call as the South countries. And their training in India is going to be 1/10 the cost in US or Canada or in UK. And that is what we have to plug. Because if you have one representative in a particular country, it makes a tremendous difference in the referral base from that. I've been a DNB teacher from 1992 onwards. And I've trained so many students, not only my own students, but even students from other institutions. And believe me, I get most of my patients from these students who are referring me patients. So I think that is very, very important. We have the knowledge, we have the abilities. We can provide these facilities to people or doctors from, say, from the African continent, which I think is a very big area to aim at. And those people will become our spokespersons for getting patients from there also. So combining all the three things together, I think that's another way of looking at things which is totally different. I mean, हम लोग सोचते हैं कि भाई health के जो tourism है उसमें हमारे को we have to get all that spit and shine, as we say, as far as the armed forces language is concerned. But spit and shine does not sustain, and it does not last long. What we need is people or spokespersons in that area who can be our spokesperson and assure the patient that, listen, I've worked there and I've found that these are the things which they are doing very well. So that's a good publicity for you and for your this thing. I think that is how we have to work it around as far as this thing. We'll talk about other things, but this is...
No, that's a great insight. And I would actually say that the first question to Abhay and to Anupam sir, they both combined, because we were talking about medical value tourism as one of the points. And sir brought in a point to include training and exchange programs, so that not only that we are actually eliminating or decreasing the need of middlemen, I would say, in the healthcare industry, which are fancily called as interpreters, but also we are making our own ambassadors in different countries where they are needed the most, and where they can get quality healthcare delivery with the more affordable way. I think that's a great point. Moving to Mr. Raj. So Raj sir represents Cadila, and he's the chairman at the corporate affairs at Cadila. So my question to you, Raji, will be, how, because you meet doctors, clinicians, management, all sorts of the verticals of the spokes of the wheel every day. As per you, in your experience, what are the major challenges a healthcare leader face, and how do you feel, what innovations can actually overcome these challenges from an Indian healthcare perspective?
Thank you, Dr. Charuji. A very relevant question you asked. First of all, I'm truly privileged to be part of this panel discussion. In healthcare industry, the major challenge is to manufacture quality medicine at an affordable price. This is the biggest challenge. To provide a quality healthcare service is not a privilege. It is a fundamental right. It is a primary need, just like a roti, kapda or makan. So it must be a fundamental right. समुद्र मंथन जब हुआ तो देवताओं ने और राक्षसों ने कोलैबोरेट किया और अमृत निकला. तो सबसे बड़ा चैलेंज जो इस बेसिक चीज को एड्रेस करेगा कि हाउ टू प्रोड्यूस क्वालिटी मेडिसिन एट अफोर्डेबल प्राइस इज ए कोलैबोरेशन बिटवीन द गवर्नमेंट सेक्टर, प्राइवेट सेक्टर, इनोवेटर एंड पेशेंट. कंप्लीट इंक्लूसिविटी of patient and innovator, private sector and government, that will address the major challenges. in healthcare sector, innovation is the major pillar. But innovation must be at affordable price. ऐसा नहीं होना चाहिए कि पेशेंट बैंकरप्ट हो जाए. मैं एक बार मीटिंग के लिए ICMR गया, तो मैंने मेरे कलीग से पूछा कि ये जो एम्स के बाहर जो ये बैठे हुए हैं, जो अपने सारा लगेज लेकर के, जिसको अपन बोरिया बिस्तर बोलते हैं, वो सारा लेके बैठे हैं, कौन लोग हैं ये? तो मेरे को बताया गया कि ये वो लोग हैं जिनके फैमिली में किसी को कैंसर हुआ है, तो ये सब कुछ बेच करके यहाँ पे आ गए. आप सोचिए कितना दुखदाई है कि किसी के यहाँ बीमारी हो गई और पूरे परिवार की लाइफ चेंज हो गई. हमें सोचना होगा इसके लिए और इसको एड्रेस करने के लिए कि हेल्थ केयर सर्विसेज जो है वो अफोर्डेबल होनी चाहिए, अवेलेबल होनी चाहिए, एक्सेसिबल होनी चाहिए और उनके बारे में अवेयरनेस होनी चाहिए. हिंदुस्तान में 30 मिनट में पिज्जा डिलीवर हो जाता है, बट एम्बुलेंस नहीं आती. ये भी, इसको भी हमें एड्रेस करना पड़ेगा. सो द इंपॉर्टेंट थिंग इज द क्वालिटी मेडिसिन, innovation that align with the present healthcare ecosystem and thus must be available, accessible and affordable. There is a need to redefine the pharma industry. जो हम बोलते हैं ना PHARMA, there is a need to redefine. P must be stand for precision medicine, H for holistic healthcare, to create holistic healthcare ecosystem. A must be for advanced, reliable and affordable manufacturing medicines. So we have to redefine this. I believe कि इन challenges को overcome करने के लिए एक effective collaboration हो गवर्नमेंट के साथ, प्राइवेट सेक्टर के साथ, इनोवेटर के साथ और पेशेंट के साथ. सो हम इन challenges को overcome करके और क्वालिटी हेल्थ केयर इकोसिस्टम हम डेवलप कर सकते हैं. हिंदुस्तान वर्ल्ड फार्मेसी है. हम जेनेरिक मेडिसिन का 25% हम अक्रॉस द ग्लोब हम सप्लाई करते हैं. सो वी हैव टू एंश्योर द क्वालिटी, क्योंकि ये हमारी स्ट्रेंथ है. हमारा जो एक्सपोर्ट है, वी आर आइंग फॉर मोर देन $300 billion in next 3 to 4 years. So yes, we have to ensure the effective collaboration to address the challenges, to produce the quality, to produce the innovative medicines at an affordable prices. Thank you.
Very well put, Rajji, and very emotionally put, you know. Especially the new pharma thing will be used by me also in the upcoming speeches. So, you know, moving to public-private partnership, Anupam sir, you know, you've seen the changing scenario. And how do you feel this public-private partnership can actually evolve the entire healthcare sector in the next maybe 2 decades? And with the change of, actually not exactly the change, but with an insight of machine learning, big data and artificial intelligence. And that will move to you as well, Manish.
Yeah. First of all, I think we are still scratching the surface as far as public-private partnership is concerned. We talk big and we do very less as far as PPP is concerned. But one example which I can tell you is of Coal India Limited and Ministry of Health and you know, some of the NGOs. They have identified 15, 16 hospitals across the country and they are subsidizing bone marrow transplantation for patients of thalassemia, aplastic anemia, etc. and giving 10 lakh rupees per transplant to the institution when they do this. The patient is selected by a committee put up by the Ministry of Health. And believe me, we have done more than 500 plus transplants under this. So that is one example of a CSR activity going highly successful. Government of India at one stage, the private institutions at one stage, NGOs as well as you know, corporate structure thing. Now, when I look at it, I constantly am bombarding ICMR and other institutions with studies to do. Where do we go wrong as far as private sector is concerned? We do not and cannot and will not ever get funding for ancillary stuff. Our institutions do not think that a research officer requiring computation of data is necessary. They think it's a waste of money and waste of time. Government doesn't give money for that kind of a thing. I think that is where people have to come in. The CSR, Google Health, for example, has to come in and put in money for that. Now, as far as AI is concerned, I'll give you a very, very small example of a friend of mine, a very close friend. We've been from medical school together, who's working as a robotic urological oncological surgeon in US. And what he said to me a few months back is that, sir, I have reached the pinnacle as far as robotic oncosurgery is concerned. And what I used to do was repair the urinary bladder and remove the urinary bladder cancer and put in its place colon. And that used to take me about 20 to 25 days to rehabilitate the patient when I was doing it routinely. With the robotic surgery, the surgery used last for 10 hours has come down to 3 hours. And the turnaround time for the patient has gone down to 5 days. So now that we have reached, my motto is that you build up till you reach a peak, and then you demolish that by building up another peak which will take you down. And what have they done? They have done AI simulation along with integration of the MRI, PET, CT, etc. And now they are using a jet of water to remove the carcinoma of the prostate. Okay? And that process is being done with a special grant from the government of USA, NIH grant, at Keck Cancer Memorial Center in California. He says, in a year's time, we'll be ready to move that, and your patient will walk in, will remove the CA prostate, and will move out by evening or the latest by next morning. So that is the use of AI and technology as far as this thing. In fact, to some extent, we are taking baby steps. National Academy of Medical Sciences has joined hands with the IIT Hyderabad to bring in an AI course for doctors. The first batch is already in. There are about 250 doctors in that, and the second batch is going to be. I missed that because I was myself not well. So I'm on the second batch, hoping that I'll learn a lot more about AI. So that is another way of looking at AI. The third way is that each and every physician should bring out a typed and prescription. And when he's putting the finger on the print order, it should get uploaded straight onto some site, maybe under the neck, so that we come to know what are the signs and symptoms of each disease, and then we can formulate our AI, takeaways with the help of that. Not only that, we have actually made that program. If you type the diagnosis of dengue, say 4 diagnoses come from Bombay, immediately it should ring a bell or red alarm in the Ministry of Health कि भैया 4 बच्चों का उन्होंने diagnose, whether rightly or not, it has come, so you better keep your high. So that is another way of looking at things and how technology can help the government and the doctors. And if you put the word dengue, it should pop up, should come. Do you want some information on dengue? And you say yes, the write-up comes. So it is a win-win situation for the doctor, for the patient who will get what we call as classically legible prescription. There are a lot of jokes about, illegibility of the doctor's handwriting, but nevertheless, you will get a legible and the government will get information. Now, we should not get stuck by purists who say, for, for this diagnosis we need these things. We can analyze that. So I think that is how. Another example which I am trying to put together is that we are now thinking of screening for thalassemia. So I talked to Dr. Arvind Lal the other day, and I told him कि सर आपके पास HPLC के आते हैं, आपके पास CBC के आते हैं रिपोर्टें, आप उनके साथ उनकी आधार कार्ड करके हम आपको वेबसाइट अगर दे दें उसके ऊपर डालते जाओ तो हमारे को तो आपके हज़ारों प्रिस्क्रिप्शंस आ जाएंगे, तो हमारे को वो टेस्ट करने की भी ज़रूरत नहीं है, खर्चा भी बच जाएगा उसका। आप उसको भेज तो हमारे को क्या चाहिए कि पैथोलॉजिस्ट शुड बी सिटिंग एट दैट वेबसाइट and analyzing and sending the answers to Dr. Arvind Lal's back lab. So that's another way of looking at, technology helping.
Predictive analysis,
Yeah.
I would say.
Yeah.
So Manish, your thoughts on this? I know time's up and we are just against the time, but your thoughts on this?
Yeah, I'll be quick because I can see people might kill me after this because I'm standing in between the lunch. So it's a bit of a loaded question, Charu, to be honest, right? It's a touchy topic, and I am at the peril of going after a legend like Dr. Anupam, but I'll still take a step. So I sit in a very interesting juncture between the management in healthcare and how tech is changing from the perspective. We have to go back on the first principles. See, we have to understand that a CEO of a private healthcare institution versus a CEO of a public sector institution, the motivations are very different in terms of the impact. When we're talking about impact today. Let's face it, I mean, if I'm working in a private sector, I'm not working for charity. I need to make the revenues and the margins count, right? At the same time, if I'm working in a public sector hospital or a healthcare chain, I'm looking at maximum population level impact, right? What is important to understand is when we look at these technologies you have named, machine learning, artificial intelligence, robotics, the 3D printing, everything. You know, there is one thing that binds them together, and that one thing is data. Unless there is a data democratization and sharing, I think Sir touched upon it. I'll give an example. Sir mentioned about the illegitimacy or that the famous doctor's English handwriting looking Greek and Latin, right? We did a project called DocLens at Google Research, which was about reading thousands and thousands of calligraphy of prescriptions and making sense of even the 2 lines that the doctor is typically marks, right? Or there's other example that I want to quote is that the world, the way we see it as an organization is that will work in that ecosystem approach. If you look at that people-private partnership, right? I'll give you an example. We work with healthcare organizations, we work with health tech institutions, we work with the pharma organizations and public sector institutions. There's one organization, interestingly, that I want to quote an example because it's very closer to my heart. That organization is working on remote ICUs in the health tech sector, which is essentially to say that you can't have doctors, senior surgeons everywhere, but can their care reach everywhere? So they have established command and control center, and where there are paucity of specialists, they give that advice. And there's a very profound case that has come that really touched, and that's where I felt so happy that how technology is making that thing count. A small child in some village in Bihar was bit by a snake. There was no doctor who specialized at that point in time who can actually treat that entire case. And this organization, which is running on tech in terms of that remotely advised, and that surgery, whatever was done, was become successful. To me, that is the kind of ecosystem enablement that we're looking at. Or the work we did at Emory University, where using artificial intelligence on data can predict sepsis happening before 6 to 12 hours it actually happens. The number of lives we can save, which that data exchange, that data information is going to be huge. So I don't know. I mean, there's a jury still out there. A lot of learned healthcare professionals. What I would definitely urge is when we are working, what could be that mechanisms where we can develop trust between the institutions? And I'm saying that trust being developed between the private sector institution and private and public sector institution, so that the data exchange can become a reality where we can have such cases. There's another organization, in the interest of time I'm not going it, which is working on actually monitoring the parameters using a sensor, which is kept under your bed. We work all sort of those organizations. The time is how can we make more of that to make that maximum impact. Thank you.
Thank you so much, Manish. So thank you so much. I know we are just short of time, so I would have to wrap it up. But the key takeaway points from this panel discussion on global opportunities would be to go ahead with medical value tourism, to definitely work for insurance for international patients, to attract more international patients and, you know, serve the help and Indian expertise. Definitely go towards health moves at the speed of trust, so go with that motto. Move from sick care to healthcare. Artificial intelligence and data democratization in healthcare is a big thing, it's going to be a game changer. Work on more training in nursing as well as postgraduate medical professionals so that more expertise and more doctor-patient ratio can be bettered. Soft skills is not any alternative, and AI cannot be an alternative to soft skills. So work on that and create SOPs for an effective healthcare delivery system. The aim is to reframe pharma industry and provide affordable and quality medications at all areas and focus on clinical research. So the key takeaway points would be this, and I really thank you all for being so patient, listening to this amazing panel discussion with distinguished leaders. There's one gentleman who's been asking for a question.
Sir, but you only have 10 seconds for that.
Institutions associated with him in the Union Budget 25, medical tourism, the here in India is prioritized. 20,000 crore budget has been
Give me
given
5 seconds.
for R&D.
Yeah.
I hope this amount will be properly, whatever you have all decisions, to initiative innovations, R&D, medicines and pharma and the devices will be done.
Yes, sir.
Very
And
well put.
thank
Just 5.
Yeah, Abhay, please.
Dr.
Yeah.
Charu has actually summarized everything, but again, like, you see the pharma campaign, I've worked in pharma sector for a long time. The global messaging, India as a pharmacy of the world, was actually built on 3 things: credibility, affordability, and sustainability. And then there was a lot of exchange, regulatory exchange program happened during that time. Experience India program happened. Now, on the similar tone, like, it's not about, again, I'm reverting back to the old point. It's not about MVT only. It's about the entire integration of healthcare services, which encompasses everything. And then technology integration. I feel this is the right time with a lot of thought process going on. I think we are at the cusp of exploring not only business opportunities, but also the opportunities to serve the global citizen. There, in fact, we talk about how skilling can help. A lot of training exchange programs are also happening, but needs to be a very well coordinated effort as done in pharma with all the ministries converging together. Thank you.
Thank you. Thank you
एक
so
line
much.
add करूँगा, one more line I will add. Without soft skill, compassion, kindness, मेडिसिन जो है कि केमिकल है, वो बीमारी ठीक कर सकती है, लाइफ सेंट्रिक नहीं हो सकती. So there is a complete inclusivity of the soft skills in healthcare ecosystem.
I would like to end my discussion by one quote, and I take this from my mother's teachings. Any person can find a disease in a person. Try to find health in that person. So if you try to find health, you'll be the right doctor, you'll be a true professional, and I think that teaching should go with my distinguished guest as well. So a huge round of applause for my distinguished guest, and thank you so much, Business World Healthcare, for this opportunity.